the molecular mechanism of action here. And to do that, I'm going to remember some of the basics of inflammation. And one of the key molecules in inflammation is IL-1 and TNF-alpha. They have a lot of the same functions. They stimulate one another. They are secreted from macrophages and other immune cells primarily. Bacterial products, toll-like receptors, can activate them, but also you can get production of IL-1 and TNF-alpha from tissue injury, various toxins. Anything that causes cell damage can lead to the production of IL-1 and TNF-alpha. Locally, there are inflammatory local effects, and then there are some more systemic effects that occur throughout the body when you get very high levels of inflammation. In most cases, for autoimmune disease, since the autoimmune disease is concentrated in a particular area, we're mostly concerned with the local effects. And so that includes local endothelial effects. It makes the endothelial cells more sticky. That increases leukocyte adherence. This brings more immune cells to the area. When the immune cells come to the area, they are activated by various cytokines, including IL-1, IL-6, and others that are secreted locally, and they will then target to that area because the endothelial cells have the adherence factors, the selectins and the integrins, which are going to cause the immune cells to roll and stop and then transmigrate and get into, say, the joint in rheumatoid arthritis. So that's one of the problems. When there is chronic inflammation, that can stimulate other cell types like fibroblasts. Most of that is locally, can increase the proliferation. That goes on in various autoimmune diseases. The callus formation and rheumatoid arthritis is some of that. That even goes on in a chronic inflammatory way in the blood vessels. So all that's part of a chronic inflammation. And the leukocytes are, of course, also activated, and then they secrete more cytokines. If there's a very high level of inflammation, usually some kind of systemic infection, then we have some of the more systemic effects, fever, increased sleep, decreased appetite, that are seen at really high levels. You can see this in cancer cachexia and HIV when there's a very high level of inflammatory effects going on. And at really high levels, it can lead to shock and other kind of problems. And then, of course, IL-1 and TNF-alpha in regular infections can also stimulate the production of neutrophils in particular and other immune cells, so it makes the number of neutrophils go up. So that's classic for what is seen in inflammation. And what these monoclonal antibodies do is they block the actions of one of these, TNF. There are some other drugs that block IL-1. They are a bit newer, not quite as effective in most cases. But blocking TNF-alpha, there's a whole host of these monoclonal antibodies now that block this and cut off the inflammatory cycle and cascade. And that helps prevent immune cells from getting to the site. It helps prevent some of the fibroblast effects here and the collagen synthesis that's going to occur, and helps prevent the neutrophils and other immune cells from being activated and getting to the site. So those are all useful things to do. One thing that's not touched on here is that when there's a lot of inflammation, this is going to help suppress the T regulatory cells when we get to the basics of why we have autoimmune disease to begin with. This is a little diagram that I made, and it's simplified a little bit, but it demonstrates the cycle of inflammation pretty well, so I want to go over it very briefly. So most of these drugs are TNF-alpha receptor blockers. There are some that are IL-1 receptor blockers. Leukotriene B4 is a product of the leukotriene side of arachidonic acid cascade. It also can stimulate this. All of these stimulate this I-kappa B kinase inside the cell. So stimulation and binding of these receptors, activation of these receptors stimulates this kinase. This kinase then goes on and phosphorylates the inhibitor here. And when this inhibitor is phosphorylated, it is tagged that's going to tag it for destruction.